There we go. Welcome to Healthology. Good morning, everybody. It's a practical perspective on natural living. Today we are actually speaking with Nancy. She is a chiropractor. It's great to have you here this morning. How are you?
I'm great. Thanks for having me.
It's wonderful to have you. So why don't you introduce yourself, what you do, how you got into your profession?
Well, I've been a chiropractor for 25 years, and I've ventured out into other areas, which I'll explain to you in a minute. But I decided to become a chiropractor because I had a lifelong history of very severe bronchial and sinus infections. My allergies were so bad that I had allergies in every season. So it wasn't just like spring or fall. And they were so bad that twice a year I would have to be on a course of prednisone because my allergy meds didn't work. Had been to 4 different allergists. At one point, I learned how to give myself shots because it was such a hassle going to the allergist. And this continued till my mid-20s, like around 25. I remember asking the nurse one day at the allergist's office, why can't you just give me more? Because this is not working. And her comment was, you probably go into anaphylactic, have an anaphylactic reaction. And I'm like, that's not going to work. So I realized it just wasn't doing anything. Like, why am I still taking these allergy shots if they're not working? So I stopped, and I didn't get any worse. I didn't get any better. And then at the age of 29, I decided to go to a chiropractor for low back pain. And I'd had some misconceptions about chiropractic. So you have to understand this was the late 80s, and people were still very skeptical about chiropractic, including myself. So I decided to go at the urging of my father, which is kind of weird that, I'm taking advice from my dad. And he's like, Nancy, I think it would be great. I think it would help you with your back pain that you've had since a car accident I was in when I was 11. And I was not driving. Don't worry. I was a passenger. Within 4 weeks, my back pain was gone. But within 6 weeks, my allergy symptoms were gone. Let that sink in. My allergy symptoms were gone. I'm 30 years old. I've had allergy problems my entire life, and they mysteriously disappear after I started chiropractic care. And needless to say, I've had maybe one bronchial infection since then. I was getting them twice a year. I've had 0, which allowed me to go off my twice yearly habit of antibiotics, and I have not been on prednisone since then. So obviously it was very impactful in my life because when you can't go outside because you're allergic to everything without taking a chance of severe allergy problems, and then all of a sudden you can, it was almost, and I don't mean to sound kind of weird about it, but it was like I was reborn. Like I'm getting another chance at life, and I'm like, I think this is what I'm supposed to be doing. I think I'm supposed to be a chiropractor and help other people like I was helped. So I enrolled in school. I had already done most of my prerequisites because I was planning on going to become a physical therapist. And instead, I decided to become a chiropractor, and I've never looked back. It was a great decision. And in practice, I've seen so many people with the same sort of health problems also get well. So it was great. Oh, the other thing I forgot to mention is I had severe menstrual cramps that were so bad. I used to have to take 1,200 milligrams of Motrin 3 times a day for 3 days, which had the effect of giving me IBD. So with chiropractic, again, my menstrual cramps, within 4 to 6 weeks were pretty much gone. I've never had to take anything for them since then.
Nice. Yeah. I know for myself with my monthly, I would have issues until I switched to cloth and then a cup, and it's like gone because there's all those nasty stuff in those products. So I know that's a contributing factor and then of course with the spine being the central nervous system in there. So that makes total sense.
Well, and what if you look at a chart of the autonomic nervous system and spinal nerves, I was having low back pain for all those years, pretty much since I started my period. And the nerves that come out of that area actually go to the uterus. So it makes sense that getting that area adjusted by a chiropractor would relieve the pressure, so it wasn't constantly putting out these signals. I don't know how else to explain it, but it was causing the cramping. There's no doubt, because my back pain and the cramps went away at the same time. So rather than throwing drugs at a problem, the drugs are only treating the symptom. They're not treating the cause. It makes sense that my menstrual cramps would go away.
Yeah, absolutely. So now those experiences brought you to your current profession, but when you have clients, what's a regular misconception you may still run into, considering it's now 2018 and there will be still people who are saying, it's quackery. Sure, whatever.
Yeah, it's funny because I think a lot of people still think that chiropractic is just for back and neck pain. They think that that's it. That's all you go to a chiropractor for. And I'm a living, breathing example of how it improved my health. There are a lot of people that think it's going to hurt, that the adjustment's going to hurt, and they're wary of that. They don't realize that chiropractors actually, I'm a doctor of chiropractic. So I did 4 years postgraduate work. My prerequisites were the exact same thing as a medical doctor. I had to take the exact same classes they did. My first 2 years of chiropractic school were identical to a medical student's, with the exception that they're learning about drugs, we're learning adjusting techniques, and we actually got more anatomy. We had a year of we call it gross lab or dead lab. It was gross dissection. Whereas a medical student will get a body that's already been dissected. I'm sorry to get creepy here for those people that are listening, but we actually had to fully dissect the body. Whereas a medical student, they just come in and spend 2 or 3 weeks and they already, they work on one that's already been dissected. So our training when it comes to anatomy is far greater and in depth. We are also trained to read x-rays like a radiologist. So we don't need a specialist as a radiologist to send our patients to. And then in the third year, I believe that medical students then start doing their rotations and they're spending time in the hospital, where we're still doing, our education. And we've done the pathophysiology, we've done the physiology, we do neurology, we dissect brains, so I think the biggest misconception is how in-depth our training is. And people just think that, just anybody can do it. And yeah, anybody can if they go to school, but it is very extensive training.
Well, yeah, because you adjust somebody's spine, you could do it wrong and potentially ultimately kill them, or you can make their life a whole lot better.
Well, I don't know of anyone who's suffered any kind of serious damage from a chiropractic adjustment. I think if people are playing around and they don't know what they're doing, but if you think about it, there's the incidences of injury, for instance, let's say from Tylenol, are far greater. The incidence of injury from a chiropractor, my malpractice insurance is about $1,000 a year. A medical doctor who doesn't even do surgery is about $25,000 to $30,000 a year. So that just tells you how much more dangerous it is to take medication than to go to a chiropractor. I've been in practice 25 years. I've never known of anybody, either personally or through my colleagues, has ever seen an injury. Sometimes people feel sore after an adjustment, and that's just because we're loosening things up and the muscles finally get a chance to relax. There's more blood flow going to the muscles, and that can actually cause soreness. I always tell people to make sure you drink a lot of water. But, as far as injuries go, it doesn't happen.
Mm-hmm. No, I wasn't trying to say that they happen. I was saying if you didn't get that schooling, it could happen.
Oh, I guess so.
So let's say for a second you had to go and seek help from somebody in your own profession, because adjusting your own spine would be one hell of a trick to do, but not the easiest thing. What are red flags that would steer you away from a colleague so that, the layman knows who not to see?
Right. So I think, first of all, I want to tell you, I can actually adjust myself. I use a technique called corn-specific technique. I use an instrument, which is actually how I adjust my patients as well. Most of the time it just taps very lightly. Mm-hmm. So I use an instrument most of the time. I can adjust somebody in any position, standing, seated, in the position that they're in pain. Let's say someone was in a car accident, I can adjust them, imagine that they're holding the steering wheel. I adjust kids with dyslexia. I have them reading while I adjust them. And it's all because of this instrument and also because of the analysis system that tells me where to go. So like one thing for me is I like going to someone who uses the same technique because it does integrate cranial work. And I do think that with the stress level in the country these days, that the cranial bones, I don't know if you want to say get misaligned or get stuck, because emotionally we're just, what we're dealing with. It causes our face to tighten up and get constrained. The food we're eating is causing damage to the brain, which is affecting the cranial bones. So I prefer to go to somebody who practices like me. However, there's a lot of other great practitioners. There's people who do something called SOT, sacro-occipital technique, which is great. Another technique I use is something called Logan, which will increase the parasympathetics. Do you know what that is? Parasympathetics, right? So the sympathetics are what's active when we're in fight or flight. And the focus of my practice is helping people with stress. So I want to shift people out of that fight or flight, and I use Logan, which takes a contact on a ligament that increases the serotonin, endorphins, and gets people out of that fight or flight. So I look for people who practice like me. For me, a red flag, and I'm not saying these people are not good chiropractors, but I don't want to go to someone who's a personal injury practice where they're only treating people that are, been in car accidents, where they use a lot of modalities. I want someone who's going to focus on stress and also correcting what we call the subluxation, which is commonly referred to as a misalignment. So that's my thing. Another red flag for me would be, because sometimes I have patients that move away and they say, how do I find another chiropractor? If they call me up and say, this chiropractor just tried to sign me up for 3 years of care 3 times a week, for me, that's a red flag. I have a hard time justifying that kind of frequency and duration. And maybe the person needs it, but how do you know today that that person's going to need that much care for 3 years? So that's a big red flag.
Yeah, I actually went to a chiropractor who tried to sign me up. Now, it was only for 6 months, but with fusion in my tailbone and my neck, there's only so much of my spine he can adjust, and there was only 2 regular spots that didn't want to sit where they needed to be. So something was going, I know I don't need this many after that x-ray, and you're telling me that I only have 2 spots. I don't need to see you 3 times a week. I don't need to even see you twice a week. What's going on?
Now, for somebody like you, I would definitely suggest you look for a corn-specific technique practitioner because of the cranial work. I've worked on people where I haven't even adjusted the spine. I've just done the cranial work because, and I'm not saying that you got a lot of emotional baggage going on.
But PTSD, I do.
Well, who doesn't, right? And when you have a spine like you've described, cranial work is amazing. And there is actually a spot on the base of the spine that if you work on that, you can actually affect all these different areas. And I do want to mention there are techniques like network that are super gentle. They involve just a very light touch. And those people usually request that you come in 3 times a week. I don't know if it's for 3 months or 6 months or whatever, but that's another really amazing technique that I personally love, because it does address more of the emotional piece.
Mm-hmm. Yeah, that makes total sense. Yeah. Well,
so I also wanted to share with you, I mentioned how I got into chiropractic, and then I had this woman who was coming to me who had very severe constipation. I mean, like, she was going to the bathroom once every 10 days, which is really bad. She was very high stress, single mom, had a mortgage, has 2 kids. They were going to be going to college soon. And her job was in sales, so she didn't have a steady paycheck. She never knew month to month what she was going to make. And I really believed, so I started working on her. She'd been under chiropractic care for 10 years without noticing any change in her constipation. She actually came to me on a lark. We had met, and I'm like, oh, why don't you come to me, because I'm so good, whatever. And she told me about the constipation. I'm like, wow, I don't know if I can help you with that, but I'd like to give it a try. So I started adjusting her like I normally did in those days, and she started getting better. I started doing some nutritional work, started getting better. So instead of once every 10 days, it was down to like once every 3 to 5. And I was like, yeah. And she's like, great. I don't need to come so often anymore. At that point, she was only coming like twice a week, and it was only like maybe 6 weeks into care. So it wasn't like 3 times a week for a year. So anyway, I wound up thinking about this. I said, I believe that the stress in your life is actually what's causing the constipation. I don't think it's necessarily the spinal misalignments or the subluxation. And she said, yeah, that would make sense. I explained to her how when we're under stress, it affects the blood flow to all of our organs, and that can cause either diarrhea or constipation. It can cause, infertility. It can cause all these different problems. And so I started approaching her from that perspective. And I started doing that Logan adjustment I mentioned to you, that it was working on changing how the body deals with stress. And within a week, she started going to the bathroom every day. And, I said to her, I really think you should get another job. I think having a sales job that's straight commission is really going to keep, feeding the fire that's causing these problems. You can't do anything about being divorced. You have a mortgage, but that's the one thing you can change. And the other thing she could change was she was doing like step aerobics, and she was doing like the type of yoga, like hot yoga. And I also suggested to her that she switch to something that was calmer, like a regular kind of yoga that wasn't like just pushing, something that was slower. And because my focus in practice is how can I help change the things that people are doing day to day, and not just have them dependent on coming to me for the rest of their life. I do believe that chiropractic care, getting checked regularly, at least once a quarter, if not once a month, is great, but I don't want somebody to have to come to me every week for the rest of their life. Mm-hmm. I want to teach them things that they can do, whether it's changing their diet, how they handle stress. And she was able to make those changes and come to see me maybe once every month or every 6 weeks. And that was amazing because it changed her life really in such a positive way. And it was very gratifying for me because I felt like, again, it was something where she was taking responsibility for her health, and she was able to move forward by just making some changes in her life.
Mm-hmm. That's wonderful. I'm glad you were able to help her, because like as a kid, I would be so high stress, I'd get stuck like that, and it sucked so bad. I mean, I'm okay now, but
well, and the thing that we're seeing how stress is affecting people now is we're seeing that with the ADD with kids. They can't focus. We're seeing behavioral problems. Are you there? Something
Yeah.
happened.
Sorry. My alarm started going off.
Okay. You were making a face. But, we're seeing ADD. 1 in 5 children now has some sort of learning or developmental issues. That, to me, the core issue is stress, whether it's environmental stressors, which is setting off some, brain swelling, whether it's just the stress of people trying to make ends meet. There's so much financial stress today. And I see that with the way it reflects onto kids, and kids are getting so much homework. They're not getting enough playtime. So they're not getting a chance to process what they're learning. They're watching video games, or they're watching shows that are inappropriate, and it's creating a fear in them. So the stress is such a huge issue that it actually led me to get involved in something called brainwave entrainment. That's a big part of what I do. Is I use something called BrainTap, which retrains the brain how to handle stress better. The Logan adjustment was great for sympathetic, parasympathetic nervous system, getting people out of fight or flight, but the BrainTap actually works directly on the brain and the brainwaves. So let's say someone has ADD, for instance, they're kind of stuck in the kind of brain waves that like we're using right now. They're called beta. They're what helps us process information. And their brain forgets how to raise something like alpha, which is a meditative brainwave, or theta, which is a light sleep brainwave. And what that does is there becomes this huge imbalance. And I believe that's the reason why most of these kids are having ADD these days, or, dyslexia or whatever. They're just stuck in these brainwaves, and their brain isn't functioning as it should. It's not functioning ideally. And that can then create, other things. We're seeing insomnia as a huge factor. I think it's 1 in 3 Americans have difficulty getting into a deep sleep. So if you're not sleeping deeply, you're not going to be as healthy. Your immune system's going to be stressed out. And then that can also cause this brainwave imbalance. So there's just so much going on in the brain. And I feel like we need to address those issues and not be thrown Ritalin and Adderall, which we don't know what the long-term effect of that is. They've never studied, can that lead to suicidal behavior, or can it lead to violent behavior? So for me, it's really about getting to the cause, treating the cause. And the cause is that the brainwaves are messed up because of stress. Let's rebalance those brainwaves. So that's a big part of what I do now. And I even work with people remotely. It's not just people in my town.
That's awesome. So if we were, wow, the thought train left the station without me. Oh, there we go. Yeah, I got it. Okay. What are some other stories that you have from your practice? Like, there's always when you practice long enough, there's going to be something that really warms the heart, or is maybe super funny.
I actually, and I think most chiropractors can attest to this, we see miracles every week in our office. There's a few that really kind of stuck out for me is when I was still in chiropractic school, I hadn't even graduated. I went to go visit a good friend of mine during Thanksgiving, and I was learning how to adjust the lower spine. And, you always want to get your hands on fresh bodies, You always want your guinea pigs out there. And I was at my friend Rhonda's. I'm like, hey, Rhonda, can I, practice my adjustment? She's like, sure. She still is a great friend. And I adjusted her, and she calls me up like 6 weeks later and says, the adjustment you gave me, would that allow me to get pregnant? And I'm like, yeah, I've heard of a lot of women that get pregnant after, that were previously infertile. She goes, I was told 5 years ago after I had my last child, because I had a lot of scarring, I needed to have surgery, that I would never have another child. And so, they hadn't been using birth control because they just didn't think it was a possibility. And I say, yeah, it's possible. So, Yeah, there was a direct link. And again, 25 years in practice, I can tell you I've seen that story over and over again, women getting pregnant, which, if anything is going to warm your heart, it's knowing that you've helped a couple get pregnant that have been trying. I've seen babies with latching on problems resolve in one visit. I've seen a woman's breast milk improve with one visit. And the funny thing about that is she was so skeptical. She came to me for back and neck pain. She came to me while she was pregnant, and she was telling me that her milk supply was low. I'm like, oh, chiropractic can help. And she's thinking I'm like a total wackadoodle. Like I am major quack. Like, how could that possibly help? And just like chiropractic helped me with my menstrual cramps, the nerves that come out of the back, she was, brand new baby. It's very stressful. You're not really sure what you're doing. So there was a lot of stress, and I'm touching her upper back and it's a mess. And I said, the nerves that come out of the upper back actually go to the breast. And let's see if we can help that. So I adjust her, and immediately the milk supply came up. So again, if this can help feed babies naturally through, by having them breastfed instead of using formula, that's great. So, those were some of those great stories as far as helping people through chiropractic. As far as BrainTap, I have two stories that really stand out. One is I was working on a teenager with very bad psoriasis. I mean, he was covered with lesions. You can imagine what that had done to him emotionally, never wanted to have his arms bare. And I was doing an ionic foot bath in combination with the BrainTap. And after a few months, you could see a noticeable difference as to how his lesions got smaller. So that was another great story. And another great story was a woman who had been abused as a child, and she was now approaching 70, had never really slept well, had anxiety her whole life, depression. And with the BrainTap, within 6 weeks, all those issues were gone. And, she, of course, she wished she had discovered that sooner, but she was so glad to at least discover that, because it was just, she had been in and out of therapy for years to deal with the abuse part, but something was still stuck in her body that wasn't allowing her to sleep deeply and just really let go. And this did. So, again, as a chiropractor, as a BrainTap practitioner, I think that I can speak for a lot of my colleagues who feel the same way. We get into this because we want to change lives. We want to help people get to the root cause, rather than, for me, I'd taken so many meds the first 29 years of my life that only deteriorated my health. So to see these people getting great changes was very gratifying. And that's why I do what I do.
That's wonderful. Yeah, it's actually, that's kind of why I started this show, was to help connect people to chiropractors, because I want, and other professions as well, because I want to fight every battle ever, but that's not possible. That's like, all right, you know what? Let's just connect people to information, and they can make the decisions for themselves.
I love that, because they're not going to hear about chiropractic on ABC or NBC, assuming they're watching, and I don't know how many people even watch those, news programs anymore, but they may hear about it on Facebook. But yeah, I do think that podcasts like this are really important, because how else are they going to find out? A lot of people do have these misconceptions, and this really helps to, people learn that, wow, her training is just like a medical doctor's, except she learns adjusting instead of drugs. So that's really cool. So I appreciate that you're doing this.
Well, thank you. So if you were sending somebody to learn more about chiropractic without necessarily going to school, what are some additional resources, books or websites, things like that?
There you can go to, if you're looking for a chiropractor or even want to learn more, there's a couple things I like. One is the International Chiropractors Association. They've got a lot of great information on what chiropractic is. I would definitely suggest that people go there. There are some books, I can't think of them off the top of my head. The International Chiropractic Pediatric Association has a wealth of information, and they do a lot of research, so you can actually look at the research that has been done. For BrainTap technology, you can learn more about that. But also, people can reach out to me. They can come to, I have 2 pages on Facebook. I post information every day, whether it's about chiropractic or herbs or nutrition. And I also post about other things, like, recently I posted an article about Tylenol. So you can learn about the problems with medications, but you can also learn about things you can do to get healthier. So I have one called Embody Health and Wellness. That's Embody starting with an M, not an E. And I have a Facebook page. I also have a website, embodyhealth.net.
Hi guys. Okay, so I had to cut off a couple minutes of audio on the end. So I'm just recording this ending explaining why, because I took extra time, which is why the new episode of Healthology is like a full day late for when it should be out. I debated over it, but she said something very important to her, but it's on a very contentious topic, and I didn't want that 2 minutes to detract from everything else she had to say. I also didn't want to deal with a bomb going off later, or even now. I don't have enough views to worry about a bomb going off in the comments or anything like that now, but it could very well come back 2-3 years later and I've totally forgotten about it and I'm going, what in the hell is going on? So I opted to cut it off. Now, you can find all of her socials and such in the description box below, and I really just hope you found and the rest of the series, that you find the whole series very useful. Now, there could be a gap in uploads. I'm having trouble with people emailing me back. They express an interest in an interview, and then they get the questions, and they more or less, the emails go into a black hole, or they feel like they're not qualified enough despite having formal education and whatnot. So I'll get the next upload done as soon as possible. It'd be lovely if it's on schedule, but I can't promise it. It's okay. You know what? I'll find more people, and there will be more episodes. That'll be that. If you like the show, please like, comment, subscribe. Bell notification tells you when I upload new videos. I also have vlogs I upload. La-di-da-di-da. There will be more designed content as well, like tutorials and such coming in the future. That's all for now. Bye-bye.